reasons that my good friend Judge Gohmert from Texas has come to the floor. He carries a tremendous amount of knowledge and a tremendous amount of passion about freedom and liberty. He's been here defending this night after night after night here on the floor in press conferences, at rallies everywhere in America that Louis Gohmert has a place to go. He stepped up to defend our freedom and our liberty like all Americans should be doing, and like the Americans that filled this capital city up today. I'd be so happy to yield as much time as he may consume to the gentleman from Texas, my friend Louis Gohmert.
And I appreciate my friend from Iowa so much, and I appreciate the wonderful points you're making. I was here just off the chamber for the whole discussion by our colleagues across the aisle, and I appreciate the gentleman yielding because I'd made a number of notes of things I wanted to. I always appreciate when people across the aisle attempt to speak for me and what I support and what I would like to have happen and what I will and do vote for and vote against. But the great thing about debate is that the other side can be presented. Of course, you know, there was the occasion a year and a half ago where the speaker cut off the microphones and that was prevented, but we stood here on the floor and spoke anyway. It's a great thing about America. But I would like to correct some things, although I know my friend had the best of intentions of speaking on Republicans' behalf. But when he said Republicans have no interest in being part of the solution, I have to differ on that. And I appreciate my Democratic friend saying we don't wish to be part of the solution, but that's simply not true. And in fact, I know Republicans have begged and pleaded to be allowed to have input into this bill, but it's hard to have input into a bill that's negotiated secretly. You get the union and ARP, and you don't tell any Republicans when they're going to be meeting, when they're going to do their secret deals. You get the pharmaceutical industry, and yes, you get insurance companies to be part of secret negotiations. And I can promise you this, every industry, every individual who has come out and said, I think this is a great bill on behalf of some industry, they got a deal cut for them in this bill. Now, this is the Senate bill here. I've had our House bill until this week. That's what I'd been working from, but it looks like they're serious about cramming the Senate bill down our throats. And they use real thin paper and print on both sides so that it's this small. But some other things need to be corrected. My friend across the aisle said during his time, our friends on the other side of the aisle support the insurance industry wanting to start all over. Well, my friend's not completely informed because there are those in the insurance industry who say, you know what, this bill, this Senate bill, it's okay with us. It will be all right. And if you're in the insurance industry and you have the federal government mandating that everybody has to buy a policy, then, you know, your eyes get big and you start thinking, wow, think of all those sales. Of course, they don't look far enough into the future and realize that plan and they themselves as insurance companies won't last very long. They'll go the way of private insurances or insurance companies offering flood insurance. When the federal government got involved, it's hard for a private company to compete with a federal government that goes in the red and stays in the red as the federal flood insurance policies have done. He also commented that the Democrats are holding health insurance accountable. And that's nice to hear being said, but if they're holding health insurance companies accountable, you would not find one insurance company that's going to be okay with this, and there are those out there. My friend also commented that 67% of Americans support an insurance exchange. Well, in the House bill, of course, we've talked about it, there's the Federal Insurance Exchange Program, And that's what will take over as they finish killing off the private insurance companies. And as my friend and I both agree, we don't want insurance companies between us and our doctor. We don't want the government between us and our doctor. And the proposals we've made get them out from between us. They get insurance companies back in the position of insuring and out of the business of managing. Why would we want the federal government to come in and manage our health care decisions when we don't even want private insurance companies managing our health care insurance?